Hello, and good evening or good afternoon, depending on where you're joining us from. I'm Shelley Full-Nasso, and I'm CEO of Cancer Nation. And thank you very much for joining us today for our town hall on the Lainie Jones Comprehensive Cancer Survivorship Act. I'm really excited today because this webinar town hall is a collaboration between Cancer Nation and two amazing organizations that we've been partnering with to work on this legislation for several years. Children's Cancer Cause and Steve Wasala, the CEO, is with us today. And the Lymphoma Research Foundation, Megan Gutierrez, the CEO, is here with us today. We've been working together for a number of years on this legislation, which was introduced last month. It's bipartisan legislation, and we're going to hear a little bit from Congresswoman Debbie Wasserman Schultz in a few minutes, who led the charge on this legislation. She's a cancer survivor herself and has been a fierce advocate for cancer survivors and survivorship in Congress. And this is the third time it's been introduced, and we're really hoping that with your help today and learning about this bill and advocating for it, helping us advocate for it by contacting your members of Congress, we can get a lot of enthusiasm and excitement on Capitol Hill about this legislation. So I want to also thank the teams at Cancer Nation, Children's Cause, and the Lymphoma Research Foundation for putting this together and spreading the word about this exciting legislation that we're going to be talking about. So I'm going to share just a couple of data points about survivorship, and then we will hear from Congresswoman Wasserman Schultz. First, I wanted to share some numbers about cancer survivorship. It's a very exciting thing that we have 18.6 million cancer survivors. Back when Cancer Nation was founded 40 years ago as the National Coalition for Cancer Survivorship, people were just starting to survive long-term after a cancer diagnosis. And with the advances in treatments and the investment in research that's been happening in this country, we've had so many more treatments and people are living longer with a cancer diagnosis. We have, there's 18.6 million, and according to the National Cancer Institute's Office of Cancer Survivorship, they're projecting 22.4 million cancer survivors by the year 2035 and 26 million by the year 2040. And 70% of these survivors have lived 5 years or more since diagnosis. 49% have lived 10 years or more, and then nearly a quarter have lived more than 20 years since their diagnosis. And we're going to hear from some survivors later in this town hall, including survivors of childhood cancer that Children's Cancer Cause advocates for, children who live longer after their cancer diagnosis and deal with the effects of their cancer treatment. We think of survivorship as beginning from diagnosis. And so when we talk about the 18 million cancer survivors, that's everyone with a cancer diagnosis. And there's nearly 700,000 people living with metastatic cancer. And this legislation would help all of those people, not just people who are completed treatment or have moved on to post-treatment survivorship. Every year, Cancer Nation does a survivorship survey, and I could spend an hour talking to you about it, but I'm just going to share a couple of data points. But one of the things that's really important to us and that we'll be talking about with regard to this legislation is survivorship care plans. And we think that it's a really important tool for survivors to help manage their lives after treatment and to help coordinate with their different healthcare professionals. And despite all of our advocacy for many years, because there have been some changes in requirements that hospitals that are accredited by the Commission on Cancer have to meet. So as a result, fewer people are getting survivorship care plans. We found last year that 36%, only a little over a third, received a survivorship care plan, down from 43% the previous year. But we also asked survivors how confident do they feel in managing aspects of their care after treatment. And they're not very confident. The only two things where more than half of respondents said they felt very confident were what scans to get and when. But when they're asked about managing things like long-term side effects, knowing what exercise to do, managing the mental health implications of cancer treatment, then they're not confident in what to do. However, those who received a survivorship care plan are more likely to feel confident. So we know it's really important to survivors. That's what we hear from survivors, but they're not always getting them. And that's something that's really important that this legislation would help address. So now we're going to share a message from the Congresswoman, and she's going to tell you a little bit more about Lainie Jones, for whom the legislation is named.
Hello, everyone. I'm Congresswoman Debbie Wasserman Schultz. I'm so grateful for your advocacy and support of my legislation, the Lainie Jones Comprehensive Cancer Survivorship Act. I want to give a special thanks to my friend and Cancer Nation CEO, Shelley Fold-Nasso. Her leadership is paramount to the entire survivorship community. I'm so excited to continue strengthening our partnership and expand access to high-quality survivorship care for all survivors across the country. Cancer survivorship isn't just a professional priority of mine, it's personal. Almost 18 years ago, I heard those harrowing words no one wants to hear: you have breast cancer. Hearing those words hit me like an anvil. Like so many Ashkenazi Jewish women, I learned I was a carrier of the BRCA2 gene mutation, significantly increasing my risk of developing both breast and ovarian cancer. For 15 brutal months, I privately underwent many surgeries. Thanks to the support of my family and close friends, I was cancer-free. But as many of you know, a person's cancer journey doesn't end even after they finish treatment. The challenges faced by survivors are too often overlooked. Survivorship is a vital component of a person's journey. The long-term health effects associated with active treatment have not gotten the attention they deserve. We need this bipartisan survivorship bill to address a person's entire cancer journey, from the moment someone is diagnosed through the end of life and everything in between. Survivorship must address the aspects of our lives that intersect with our physical and mental health, like education, work, transportation, children, and more. I named the bill after my late friend and constituent Lainie Jones, who suffered from Lymphoma syndrome, a rare genetic disorder that made her prone to multiple cancers. Before she passed away last year, Lainie battled and survived 7 different types of cancer. But Lainie never let her cancer define her. She lived life to the fullest. And that's what this bill will help survivors do. Thank you all again for showing up and using your voice to support this bill. Your work matters, and it makes a real difference. The grit and tenacity of the cancer community is the strongest in the world. And when we come together, there is nothing that can stop us from achieving a world without cancer. I will always be by your side on this journey, and together we will win this fight.
Hey, so now we're going to talk a little bit about what is in this bill. It's called the Comprehensive Cancer Survivorship Act because it has a lot of different provisions in it. And Meg and Steve are going to join me in kind of walking through some of these provisions. So we already talked a little bit about survivorship care plans. The first provision that we're going to talk about is Medicare coverage of care planning and coordination. This is really a payment through the Medicare program for clinicians to provide care plans to cancer survivors. And it wouldn't just be at that transition to post-treatment care. It would be available at diagnosis, during that treatment decision making and care planning discussion, so that patients can walk away with a written plan that helps them understand what to expect and how to address side effects that may come up. And then anytime there's a change in the course of treatment, if there's progression or treatment is changed because of side effects, and then at that transition to post-treatment survivorship. The reason we're advocating for Medicare payment is that we know that clinicians are very busy. They're very focused on treating people with cancer. The care planning sometimes requires work outside of that face-to-face visit with the patient to actually create the plan that then they share with the patient during that visit. And right now the payment isn't adequate. And we know that if there was payment, that would be more incentive for the clinicians to actually create and provide these care plans to cancer survivors. It's focused on Medicare because that's what the federal government can legislate in terms of what is paid for. But we know that private payers, that many people have insurance through their employers or through the Affordable Care Act insurance, then they often follow what Medicare does. So if you're trying to get something paid for and really adopted into practice, going to Medicare first is the best way to go. And then you hope that the others will follow and provide payment for these services to other patients who are not on Medicare. So this is something that's really important to all of us. And when we talk with our patient panel, our survivor panel, they're going to share a little bit more about the importance of care planning to them and survivorship care plans. So that's why we think this is so important, because it's what we hear from the people that we serve and that we represent in Cancer Nation, Children's Cancer Cause, and Lymphoma Research Foundation. I think Steve is going to talk about the stakeholder meeting on survivorship transition tools.
Thanks, Shelley. This is particularly exciting because I think what the bill sponsors have put into the bill is, how do we harness information technology to improve transitions in care from active treatment to long-term survivorship care. And I look at this as sort of like, how do we come into the 21st century for survivorship care? And I think more than ever, consumers and people, because of technology, are consumers of their own health. And we have such a great opportunity to look at how can we harness a technology to have better patient enabled interfaces with clinicians, tools that will help survivors get the tests and do the things that they need to be healthy post-treatment. And most importantly, I think really having a record of care easily accessible. So having multiple stakeholders, the best and the brightest in technology and health, looking at various ways to do this and then publish it, I think will just get more wider adoption and can really be exciting for survivors.
Great, thank you. Now, Meg, you want to talk about the alternative payment model?
Absolutely. So cancer survivorship care, when it's available, is too often fragmented, shared among oncologists, primary care physicians, and other specialists. I'm thinking right now of a lymphoma survivor I spoke to earlier this year who unfortunately developed a cardiac condition several years after his treatment, several years later after his lymphoma treatment concluded. He didn't know if he needed to loop in his oncologist into the conversation or how he should obtain and provide the information on his cancer care for his new doctors. Survivorship can also be poorly defined. I hear from patients all the time, as I do Shelley and Steve, should survivorship care start at the time of diagnosis, during treatment, afterward? It's very challenging to define that universally. Some survivorship care includes care plans, as Shelley pointed out. Sometimes it may not. The study and report detailed in Section 6 could help us quantify and better understand the gaps that exist in survivorship care, identify unmet needs among cancer survivors as that continues to evolve, evaluate existing access and reimbursement barriers, and then assess the variations in care quality and outcomes that we see. This evidence, in turn, could help policymakers in the cancer community design a system and a payment model grounded in data, and that also can aid us in the coordination of activities that should be provided to all survivors.
Thank you, Meg. I'm going to talk about the Cancer Survivor Employment Assistance Program. What this would do is offer grants to nonprofit organizations to provide education and support to cancer survivors who have workforce challenges. In our survey in 2023 and 2024, we asked survivors about their experiences of working during their cancer treatment. And we know many people work during their cancer treatment, some because they have to, because they need to keep their insurance, they need the money, and others because they want that sense of normalcy in their lives. They want to have something to think about besides cancer treatment. And usually it's a mixture of both. But there are so many barriers to people continuing to work through their cancer diagnosis. They don't always have the time off that they need. Transportation and childcare can be an issue. It's very challenging to maintain a full-time job while you're going through cancer treatment. And yet we know that many people have to do that. So this provision would actually help nonprofits that are working to support cancer survivors with some of those workforce challenges. And Steve, I think you're going to talk about the progress report.
Yeah, this is another provision. Thanks, Shelley. In the bill that I think could have a really big impact. And there's a government agency called the Government Accountability Office, or GAO. They actually have their own building. I've walked by it, so it's very real. And they are essentially there to make sure that Congress is accountable for the money that's appropriated and the policies that have been enacted. So we work with them on various things, and this particular provision would look at what has happened since President Nixon enacted the National Cancer Act of 1971, and what are the contributions of the Office of Cancer Survivorship to the evolution of survivorship care. So two very important things, and I think that when the National Cancer Act was authorized, it really was about the war on cancer that continues to this day. It dramatically expanded the scope of the National Cancer Institute, or NCI. It enacted 15 comprehensive cancer centers, the National Clinical Trials Network, and the Presidential Advisory Panels. So these are all things that the bill sponsors recognize that are so critical to advancing the federal commitment to cancer care. And so we're excited that this is in there as a formal provision.
And then you're going to talk also about the Medicaid coverage for survivors of childhood and adolescent cancer.
Yeah, thanks again. This is really important because we know that at least 1 in 3 cancer patients that are diagnosed, pediatric cancer patients, are on Medicaid, and it's so critical to their care and their long-term prognosis that Medicaid is there for them. And what this provision really does is it formalizes and makes real what we call the transition of care plan that you had alluded to earlier in your opening. And we know that having a survivorship care plan and moving from oncology or cancer care to the wider community of primary care is a really difficult transition for most survivors, and particularly in the pediatric population or young adults, since so much of the treatment is done at a young age. A lot of times survivors have no idea of what they went through. It's not written down, and they really are unsure about where to go next. It can often be like, I want to move past this and get on with my life, but that's just the beginning really of survivorship care and the continuum. So having this transition and having it guaranteed as a Medicaid benefit will not only benefit the Medicaid population, but can serve as a real model for survivorship care for other segments as well.
Thank you. And now I'm going to turn it to Meg to talk about the last two.
Thanks so much. So this next section addresses an issue that unfortunately organizations hear and see about every single day. We hear from young people diagnosed with cancers like Hodgkin lymphoma, who will undergo treatment regimens that can impair or permanently take away their ability to have biological children in the future. Many of these young cancer patients haven't started families at the time of their diagnosis, and even if they're not yet thinking about having children, preserving their fertility protects their future options. This can be an incredibly costly undertaking at a time when a patient may also be feeling the impact of the financial toxicity that can accompany their cancer diagnosis. And so this section would help address this issue by ensuring coverage for their fertility preservation services under Medicaid for individuals diagnosed with cancer who are undergoing treatments that can lead to infertility. For adolescents and young adults, preserving fertility can be a significant quality of life issue that extends far beyond their cancer treatment and into survivorship. And then finally, as we move into the Office of Cancer Survivorship and the final provision, to describe this section, I'm actually going to take us back to 1996 when cancer survivors celebrated the White House's action to establish the Office of Cancer Survivorship within the National Cancer Institute. During an Oval Office ceremony, our community applauded the new office, which was focused on the unique physical, psychological, social, and economic needs of cancer survivors. In the 30 years since, the need for the Office of Cancer Survivorship, as Shelley pointed out, has become even more pressing. The number of cancer survivors is growing, and their needs are only intensifying. For example, the increased incidence of cancer in young adults, which we have touched on a few times today, are diagnosed and treated as they are beginning their work lives, starting families, and bearing children. Or think of a lymphoma patient diagnosed later in life who's now able to access innovative treatments like CAR T-cell therapy and who need to think about other health conditions in addition to their cancer and managing their health overall. This provision would place the Office of Cancer Survivorship within the Office of the Director of the National Cancer Institute and provide it the authority to undertake and also fund cancer survivorship research, support initiatives aimed at improving the length and quality of life of cancer survivors, and engaging in education and communication efforts serving survivors, cancership researchers, as well as clinicians who care for survivors. The Office of Cancer Survivorship has been and must continue to be a leader for survivors, and a strong legislative authorization is critical for this office and for the survivors that are served by the office. We would all argue our community deserves nothing less, and that's why this final provision is so critical to place priority on the issues that we've been talking about today. Back to you, Shelley.
Thank you. Before we get to our panel of survivors, I wanted to point out a few things I neglected to mention. We heard from Congresswoman Wasserman Schultz, but what's really important about this bill is that it is bipartisan, and she introduced it with Brian Fitzpatrick, a Republican from Pennsylvania, Congressman Mark DeSaulnier, a Democrat from California, who's also a cancer survivor, and Joe Wilson, a Republican from South Carolina. All of our organizations are nonpartisan, but we work with Congress in a bipartisan way. So we work with both parties. And I think it's really important because we know that cancer touches everyone in some way and is not a political or partisan issue. So we're really grateful that Congresswoman Wasserman Schultz has always strived to have bipartisan leadership on this bill. And there's I think there were 13 as of last count co-sponsors. That might have gone up in the last few days, but I haven't checked. There's 435 members of Congress, so we need to get them all on it, or as many as possible. And we'll talk a little bit later about how you can help with that. It has not yet been introduced in the Senate, and we're working with a couple of different champions in the Senate to get that introduced, hopefully also in a bipartisan fashion, because we know that bipartisan cooperation is so important. Also, there's been more than 50 national cancer organizations that have signed on to endorse the legislation, and those are listed on our website, and we'll also share a link. If you represent an organization that hasn't endorsed it, you can let us know and we will add you to the list. So now I'm excited to bring up a panel of wonderful survivors to share their experience and why they think that this legislation is important. And thank you to my colleagues for sharing in the chat the links to more information on our websites. So I'm excited to have joining us today Sierra Morgan, who represents Children's Cancer Cause and is a survivor of pediatric cancer, Whitney Neighbors, who is on the board of the Lymphoma Research Foundation, and Daria Ross, who is a Cancer Nation ambassador, among many other things that Daria does. So I'm excited to have all of you here with us, and I would love for each of you to spend a few minutes sharing a little bit about your story and your experience. And I'm going to start with you, Sierra.
Hi guys, thank you so much for having me here today. It's been great listening to everyone talk before. So yeah, I am Sierra. I am 23 years old. When I was 14, I got diagnosed with carcinoid cancer in my lung, and I had a complete pneumonectomy of my lung to get rid of the cancer. And then when I was 15, the cancer came back, and a little bit about carcinoid cancer. It's a really slow growing type of cancer. So I've had it since I've been 14 to now at 23. My tumors are kind of all over the place, but they're pretty tiny. So me and my oncologist work together at North Shore LIJ in Long Island, and we have been had me on this treatment plan since I was 15 of doing chemotherapy and immunosuppressants. And yeah, and basically since then I've lived a semi-normal life. I finished high school and I graduated from USC, and I'm going to law school in the fall. So I've been doing a lot while doing all of that. And I'd have to say this bill is really important to me because I also did my senior capstone at USC on cancer survivorship. And there has been a lot about when I got diagnosed, I didn't really know much about what was going on. It was like kind of my mom dealing with everything. And then as I got older, I had to like learn what was going on, especially in like the financial aspect of like paying for treatment and then getting treatment and kind of like figuring out how that works into like my everyday life as an adult. And like also growing up with cancer was kind of difficult because not everyone around me was going through the same thing, but like I was trying to be as normal as possible. Um, but yeah, so basically that's how it happened for me. And yeah, I'd say I think survivorship starts when you get diagnosed and then continuing because although I still have cancer, I kind of struggle with the fact that like I don't think about it all the time, even though it is there. But at times when like what's difficult for me is I moved away from home. I live in California right now. And well, I've been away from home. I've gotten a lot of infections and because I'm immunosuppressant and all the things like that, it's like that was kind of a hard like thing dealing with how do you figure that out, like being on your own, but still having cancer and all of that. And then also I really like how the bill touches on fertility because when I was diagnosed, we didn't even think about like doing anything with fertility because I was 14. But then as I got older, my oncologist like took me through the process of getting my eggs out. And that was something that I also wasn't prepared for because it's not something I thought about when I was 14. But now that I'm 23, like we are thinking about like preserving fertility and everything. So yeah, I think this bill is just really important and it could help a lot of people, including a lot of childhood cancer survivors who transition to adulthood and either still have cancer or don't have cancer anymore and have the side effects from it. But yeah,
Thank you, Sierra. Thanks so much for sharing your experience and congratulations on your graduation and going to law school. That's amazing.
thank you.
So, Whitney, I'm going to turn it to you now to talk about your experience.
Hi, thanks, Shelley. And I apologize if I have some background noise, but I really appreciate the opportunity to speak today with everyone. As Shelley mentioned, my name is Whitney Neighbors, and I'm an 8-year cancer survivor of stage 4 diffuse large B-cell lymphoma. And first, I want to start by giving thanks and my eternal gratitude to all the scientists, doctors, nurses, chemists, students, and their families that supported all the sacrifices that they made in pursuit of cancer treatment and therapies that gave me and so many others the gift of being able to say, I am a survivor. But I'll start with from my diagnosis. I went through 6 rounds of R-CHOP chemotherapy with 2 rounds of high-dose methotrexate. And after that, my cancer was gone. I had the good fortune of an amazing oncologist who I continued to see immediately after the treatment for follow-up. But then my doctor left my treating hospital. And then my confusion started. I felt like my anchor had been cut and I was adrift. I was transitioned to my hospital's survivorship clinic. And while I'm grateful to have access to that clinic, I think because I was in this limbo space with my doctor transitioning out and me transitioning, I was never given a formal survivorship plan. I saw different practitioners repeatedly. I was frequently repeating my same questions and my concerns. And while, yes, my cancer was gone, my body was changing and in ways I didn't really expect to happen. I experienced odd occurrences and symptoms. And the question is this from my cancer treatment or is this just a natural part of aging? Maybe is often an answer I would get. And I feel like that answer should be more definitive. I'll say that after my treatment, I had a compulsive need to engage with the community that saved my life. I started with fundraising. It progressed to serving as a patient advocate. Then I chaired a scientific study participant advisory council. I write patient support letters for medical research grants. And now I'm serving on the board of the Lymphoma Research Foundation. And it's through all of these touch points that's exposed me to many of my fellow cancer survivors. I have learned that they have the same types of unexplained or unexpected symptoms that our non-cancer peers don't have. And they've shared their stories of their loss of vision, extreme light sensitivity in their vision, DVHT, skin conditions, gut and digestive issues, early onset menopause. I mean, the list goes on, brain fog, the things that you never seem to be able to recover from, and accelerated aging, it's real. And I'm here to say that I think it's time for phase 2 of cancer treatment. The research and support for diagnosing and treating long-term side effects and early detection for secondary cancers, I think, is important. We live in such an extraordinary time where a generation is growing up thinking that cancer isn't automatically a death sentence. I mean, how awesome is that? And I think now it's this class of survivors are growing, Shelley, as you mentioned. Right now that's 20 million people almost in the United States. And they project in the bill it's written that by 2040, we're going to have close to, I believe it is 26 million people. I mean, it's a staggering population. And I think it's for those reasons that we need to really start to look to our congressmen, to everybody to support this bill and help survivors continue to thrive. Thank you.
Thank you, Whitney. And now I'm going to turn it to you, Daria.
Hello, everyone. Thank you so much. My name is Daria Ross. The first thing I want to say is thank you to Cancer Nation for inviting me to be a part of such a timely, relevant, and critically important conversation. This bill is so necessary. So my name is Daria Ross. I am a triple negative breast cancer survivor. This year, 7 years. I am a public health professional. In 2018, at the age of 47, I was diagnosed with stage 2, grade 3 triple negative breast cancer. And as many may know, that is an aggressive form of breast cancer that disproportionately affects Black women. No one understands why necessarily. I underwent 15 rounds of chemotherapy, 30 rounds of radiation, and I had a bilateral mastectomy. And so I am really grateful for 7 years of survivorship. Last year, at my 6th year, my oncologist told me at an appointment, this is it. You're done, you've graduated. And that was the second time that I felt this safety net sort of drop. The first time was when I finished active treatment. And at that time, for me, it was chemotherapy, radiation, and tumor removal. That was it. At the time of my diagnosis and at the time of active treatment, I didn't know to ask about a clinical trial. And while I got phenomenal care at the cancer center where I was treated, I didn't know to ask for one, and it wasn't offered. And so I love the notion that survivorship begins at diagnosis. That was one of the many principles that being associated with Cancer Nation has taught me. Survivorship is certainly more than being cancer-free. As has been mentioned by my other panelists, it involves managing long-term physical effects, your emotional health, follow-up care, screenings, financial concerns, and just really understanding what type of quality of life do you want for yourself. And often when you think about it, there's so much cognitive load. You're just going through it and you're just being reactionary and responding to what's right in front of you. So you don't even really often get an opportunity to pause and take a beat and really consider what type of quality of life you want. And then in my instance, okay, chemotherapy, radiation, that's it. Those are my options. That was it. Of course, those were great options. And here I am 7 years cancer-free. However, survivorship is so nuanced. And it's not lost on me that, for certain populations, Black women, the disparities that affect diagnosis and treatment, they don't go away when treatment ends. Those disparities, all of those disproportionate issues that affect certain communities and populations, they prevail. They still exist. And if you have barriers in front of you before that, those barriers are there afterwards. And so I think this conversation is really important because access to information, support services, that's why I love the employee assistance program part of this bill. I think having resources, having financial resources are critically important. and supporting people with childcare and helping people get to their appointments. All of these things are necessary. And so I think that this bill is so important. That's primarily why I'm here. That's what led me to pursue a career in public health. After being diagnosed, I went back to school and pursued an advanced degree and finished my master's in public health. All of that because of my cancer experience. And so while this community is not necessarily one that everyone's running to be a part of, it has certainly changed my life. And I see life through an entirely different lens. And I think it's so important that we advocate for this bill, as everyone has said. And thank you again for having me.
Thank you, Daria, and congratulations on getting your master's in public health. Very exciting. So now I want to bring you all into the conversation and just talk a little bit about, I know you've each talked about managing your health, managing your side effects. Sierra, you talked about how you had to sort of take on this role that your mother used to play for you and like kind of figuring all this stuff out. And I was really struck by what you said, Whitney, about maybe being told maybe that's related to your cancer. And I know that's not helpful to know that like you want to understand better. And I've heard from survivors that a lot of times it's like, if we don't really know what caused it, it's hard to figure out which doctor is going to help you. And you end up going to all these different specialists and nobody really knows and they don't necessarily always coordinate with each other. So I just wanted to see if either any of you, each of you would want to expand on kind of how you had to manage your care and navigate between multiple different specialists and what do you think could be more helpful in making that process easier for cancer patients, cancer survivors?
I would say that for pediatric patients, something that like was kind of like in the air was transitioning to adult care because I've always been treated in like the pediatrics unit. And then once I turned 18, I have to like I see an eye specialist because I have some cancer in my eye and like other like just like specialties like that. Um and I'd say like I'm like used to like being in the pediatric wards and no one like really prepared me to be in the adult ward when I turned 18, even though I still felt like a kid. Um so I feel like kind of like getting like some clarity there for like childhood cancer patients who if their cancer comes back and they need to go back into treatment or if they're just like doing follow-up care and like knowing that you do have to transition to an adult ward. Um, for me, my pediatric like oncologist, she still sees me, and then we have like adult oncologists also overseeing me who specialize in my cancer. So it's like kind of like a team of people working together. But I'd say that it was like my family and I who kind of took like initiative to get all that together. Like no one was there kind of helping us through it. Like we kind of had to figure out what was best for me. So I feel like there's a lot of advocating for yourself, especially like when you're a child, like your parents are, and some people might not always have that. So I'd say that's like an important aspect, like coming from pediatric cancer to adult cancer.
I would I would agree with Sierra. I know one of the things that was challenging for me fairly recently, when you are in active treatment and when you are under surveillance, you typically, or in my experience, I had a cadence of seeing a specialist every 6 months. So because I was seeing my oncologist, my radiation oncologist, and my plastic surgeon regularly for 6 months, it took me off of the routine of a primary care physician. And so by the time I finished active treatment, and when I transitioned last year from not seeing the oncologist, I wanted to get back with the same primary care physician. And because I hadn't seen that primary care physician for over 3 years, I was now considered a new patient. Now, that's a systems issue. And if I hadn't pushed to say, I'm actually not a new patient, I need to get back on the schedule, I wouldn't have been able to do that. So, similar to what Sierra has spoken about, you really have to advocate for yourself. And not everyone knows how to do that. And it isn't because there's a lack of engagement or as a patient, you don't care. you don't know what you don't know. And so because of my personality, because I am someone who won't take no for an answer necessarily, I remember when I found this primary care physician, I called to make an appointment. She wasn't accepting new patients. And at the time I was on Twitter, I tweeted her and I said, I'm hoping that you can accept at least one more patient. And she DM'd me, direct messaged me back and said, call my office, we'll get you in. And we often joke about the fact that she has never gotten a patient that way on Twitter. So I think, again, that's my approach. It's who I am, innately. But that's not the typical experience of many patients. And again, when we talk about many marginalized communities, you just don't know what to do. And so I think that being a self-advocate, knowing how to do that, and that's something also that I just really stumbled upon. I didn't even know that there was this whole, what I like to call, subculture of cancer advocacy in all of these organizations before I got sick. I was just sharing my story online as a way of healing and thinking that and hoping that I could be encouraging to someone else that may experience this. And an organization reached out to me, and that's how I even stumbled upon advocacy. So often patients don't even know that these communities and that these organizations exist, which really speaks to why having survivorship care plans is so critical.
Thanks, Daria. And before I turn it over to you, Whitney, I just want to say that we did a survey of primary care and oncology clinicians that'll be coming out soon, and we asked about some of these, about some of the issues of going back to primary care and coordination of care. And I also want to thank you, Daria, for pointing out that you are able to do this advocacy for yourself, but a lot of people can't do that. They may be, they could be older and they don't have a family member to help them. They could be, people sometimes equate it with health literacy. You can have all the health literacy in the world and feel overwhelmed by your diagnosis and not able to do that. So we like to try to say that, we want to make sure the system works for everyone and that you don't have to become this advocate for yourself to get the best care. But I don't think we have that system yet, and that's why you end up having to do that. So now I'm going to turn it to you, Whitney.
Well, I agree. And I think sort of looking prospectively as to what could possibly work best in the future, I think a common system where once you're diagnosed with cancer, you start your survivorship tracking so that any physician that you could see would have access to your historical information so that they immediately are put on par with anybody else that would answer you. And I think that could possibly help eliminate a lot of the back and forth of go see this person, go see that person, go see this person. I really think some sort of a common system would be helpful. And in reading the bill, it looks like there are funding for education resources for treating centers and further education for doctors and their other physicians. I'm sorry. And I think that would be a great way to incorporate, this commonality that could provide for service. And I think, it's been said by both Sierra and Mara, it's you want to self-advocate and sometimes you're not able to. And I think if we could get, this common system, they're going to see the repetitive nature and start to maybe identify these outlying issues that people are experiencing. And they can go back and see, oh, it's because you had treatment for a specific type of cancer, and they can know what those therapies may or may not be causing in the long term. And I think that would be so pivotal to have everybody be able to share that information and you're not starting over. I think that's also one of the complexities and one of the most anxiety driving things for patients. And especially, as you mentioned, those that don't have a care system or don't have a support person, to not have to continue to repeat their story, to not have to continue to educate people. It's a traumatic experience to be diagnosed with cancer, to go through your treatment, to be re-diagnosed with cancer, as is the case many times, and to have to continue to relive that over and over is a simple thing that I think we could eliminate if we had a common system.
I want to just add to that, because what Whitney said is so critical. But often you stumble upon these things that you realize after the fact are, you know, nuanced and affected and a part of your survivorship journey. I thought I was clumsy. I've mentioned this. I really thought I was clumsy after I was in active treatment. I kept, why am I, falling? And I had no idea. Well, as it turns out, I was at a Cancer Nation summit talking and convening with other survivors, and found out through conversation that it's because of, it's a long-term effect of chemotherapy and the neuropathy. And I had no idea. And so you just don't know. And then, as Whitney, you've pointed out, is it old age? Is it menopause? Are you just tired? Is it the anxiety of everyday living? We don't know. And once you are in this club of cancer survivorship, everything that your body does, you're reacting to everything that happens with your body, because you're wondering, could this be a recurrence? That never goes away. That never goes away. And again, having that survivorship care plan as a guide, to sort of be a compass would be so tremendous. It's just critically important.
Thank you. And thank all of you for sharing your story. I think it's so important what you were saying, Daria, because a lot of people who've never had cancer or aren't close to it don't understand that, I think when we ring a bell, it's a really great thing. People, gives people the sense of satisfaction that they finished that last treatment. But it also gives that false impression that you're done, and you're not done. Cancer is never done with you. You're dealing with those effects for the rest of your life. And I think, and I've heard from a lot of people too, that their family and friends don't understand that. They think, well, what's the big deal? You're done. You rang the bell. And so having people like you sharing your story, and then hopefully Sue is going to talk to us about calling your members of Congress. If you call them and talk to them about it, then they need to understand too that survivorship is a lifelong thing. It's not just going through treatment, and you're not done when you're done with treatment. So thank you all. I'm going to invite Sue to join us now, and then when Sue finishes and we have time for Q&A, we can bring you back. So now I'm excited to turn it over to Sue Emmer of I Street Advocates and Children's Cause to share a little bit more about how you can call your members of Congress and ask them to support this bill. So let me bring the slides back up.
Thank you, Shelley, for having me. So thank you for sharing those amazing stories and for your incredible advocacy. I want to talk to you now about how we can try to work to get this legislation passed so that there are more tools out there to both enable your advocacy, but also help those who can't do that. So the first thing I want to talk to you about is the process that you would go through. A number of you in the chat said, how do we get this passed? What can I do? Well, this is what you can do. So the first thing you need to do is to contact your representative, your member of Congress, about the Lainie Jones Comprehensive Cancer Survivorship Act. This tool we have up here is the house.gov, www.house.gov. And basically, using that tool, you would put your zip code in the little section that's on the upper right-hand side, and where it says look up, and that would tell you who your member of Congress is. At that point, you could do one of two things. You could call the main switchboard, which is on here, 202-224-3121, and then ask for that member of Congress you just heard about. The other thing you can do when you put your zip code in there is it will take you to your member of Congress. Some of you may want to click on that website, learn about the member, and get the phone number that way. So both approaches are right, and it's really up to you. So when you call over, here's what you need to do. It's a very straightforward process, and one of three things can happen. The first thing that you would want to do when you get the front desk is to ask to speak to the staff person that handles healthcare. You can just say it like that, or the legislative assistant that handles healthcare if you want to be precise, but either would be fine. When you do that, a couple things might happen. The first thing that might happen is the front desk might say, well, that person is unavailable. Would you please share your concerns with me? And so if that happens, if you get the front desk, so to speak, that's going to be a very quick interaction, maybe 1 to 2 minutes. I'm going to talk to you now about what you should do. And another point, and I'm going to say this again, is don't be nervous. You're exercising your right as a constituent, a fundamental right, and they're really there to hear from you. So the first thing you're going to do then is say who you are, um, that to give your name, and to say where you're from in that district. So you're establishing your role as a constituent. So in my case, I'm from Bethesda, Maryland. That's what I would say. And then you're going to say why you're calling. I'm calling to ask that representative to co-sponsor, to support, but really to co-sponsor, which means to sign on as a supporter to the Lainie Jones Comprehensive Cancer Survivorship Act, or HR 8839. Then you're going to say, here's why this is important to me. I'm a survivor, or my child is a survivor, or my mother or friend is, or I'm for whatever reason, why you're an advocate. And you're going to say that succinctly, but all of you have compelling stories. Then I'd love you to just say this is an important bipartisan bill, because it is a bipartisan bill, and then again restate what we call your ask, which is I'm really asking the representative to co-sponsor this bill. So that's the first option. The second option, and the hopeful option, is that they're going to pass you through to the healthcare staffer, and you're going to have the opportunity to convey this message to that individual. In that case, you can probably talk a little longer, not too long. Everyone on the Hill's rushed, but you're going to go through those 5 points I talked to you about. You're going to, again, really make sure you establish where you're from, that you're a constituent. You're going to say the name of the bill, hopefully the bill number. You're going to talk about your story, say the bill is bipartisan, and ask that they co-sponsor it. And if by any chance they ask you for more information, you are going to reach out to one of us in any way, shape, or form where we can follow up with more of that information. And hopefully you have our contact information. The third outcome is that you are going to be provided the opportunity to set up a meeting with this individual and to have a proper meeting where you can really go through all these items in greater form, in private, probably virtually. So in any of those cases, it's really the same process. It's just each of the situations and scenarios I told you about, each one could be a little longer, but the last one being maybe 10 minutes at the most. So here are a couple things I want to say to you that you should do and you shouldn't do. Number one, do not worry about being a policy expert. You're not there in your role as a policy expert. You're there in your role as a constituent and someone who's been touched by cancer as a survivor or a family member, something like that. So really lean into that. Another thing is stay in touch with the office. It's very unusual that someone is going to on the spot say, okay, I'll co-sponsor it. Usually they have to prepare a memo for their member of Congress. And, typically with what we do, you need to be a little persistent and use those advocacy skills. So reach out to them again over time, checking in, not being overly persistent, but polite, but stay in touch with them. So really do all of that. And that's about it for all this, but really hope that you take your powerful experiences and help us get more co-sponsors. Right now, there are, I think, 12 co-sponsors. And we know with your help, I looked, there were 145 of you on when I started. So if each one of you reached out to your member, within a couple months' time, we could really make great progress. Thank you.
Thanks, Sue. And I just wanted to go back to the slide and just mention two other things. If you represent an organization that would like to endorse it, we put the page on our website that has more information about the bill in the chat. If you go there, there's a link to a form to sign on as an endorser. I mentioned that there were over 50 organizations that have already signed on to support the bill. I think hearing, like when we can share that list with members of Congress and they see how many people are supporting it, it helps them see that there's some legitimacy to it and that there's a lot of interest in the cancer community. So you can add your organization to the list. And then we also have on our website a social media toolkit that you can use if you want to share about this on social media and ask your followers, your friends, your colleagues to also call their members of Congress to try to amplify support for the legislation. We also put in the chat the links to Lymphoma Research Foundation's website and Children's Cancer Cause website, because all of us are kind of emphasizing this, or we're all focused on this bill, but we may have different takes on it based on the population that we serve. Sierra talked a little bit about that transition, how challenging it was to transition from pediatric care to adult care. And that's one of the things that this bill would address, that Children's Cause is really uniquely qualified to talk about that. And so there's resources on all of our websites about the legislation. So I'm going to stop sharing now, and then we can, if there are any questions in the chat, we can talk about them. Can we share this with our local community? Absolutely, definitely. That social media toolkit will give you things that you can share, posts that you can use as a starting point, and then you can update them to put your own experience in there. I think it's really important to share with family and friends who may know you're a cancer survivor, but they don't necessarily know all the things you've gone through. And if you say, you know, I'm done with treatment, but I'm still living with the effects of cancer, and here's a way you can help, then you might be able to get other people to call their members of Congress as well. You a question about emailing. You can email, definitely. Calls, I think, are better. Sue, you tell us what you think, calls or email.
Yeah, I think I'd say whatever you're comfortable with. I think calls are probably a better way to rise up from the chatter. These staffers get an incredible amount of email, and it's also hard sometimes for you to get the health staffer's email, so you may not even be emailing the right person. So, but I think either is fine.
And if you are talking with them, either the person who answers the phone or the health staffer, get their email address so you can follow up with them afterward. Right. But it's not always, if you're going to go to their website and put in, you know,
It's not
the
obvious.
contact me form, you don't know who's going to get
And
it.
and then also use social media too. Some people we heard about that earlier, and it is more and more members and their staff are responding to that.
And I know that our Cancer Nation advocates are going to be on the Hill next week, meeting with their members of Congress. And we hope that if you want to make your calls on Thursday of next week, so that they're hearing from people calling in addition to the people coming into their offices, even better, because then it just kind of gives that momentum of, like, if they're hearing over and over about it, then they think, oh, this is something I really need to look into. And they do have to, you know, they do pay attention to the calls they're getting, and they take that back to their boss, the member of Congress or the legislative director or both, and say, you know, we're hearing from our constituents about this, and they'll go research the bill, learn more about it, and bring a recommendation to their boss. So, but it starts with them understanding that it's important to the people that they represent.
So if I could just add, you know,
Yeah.
to what Sue had said, you know, just my experience when you have a meeting, asking the Hill staffer about their personal experience with cancer really is something everybody has been affected by, and you learn a lot about not only them but even the members sometimes in terms of their relationship with cancer and how they've been affected, and it just helps with the meeting and the conversation.
Yeah, it's great. All right, I'm going to ask Meg if you want to have any final words before we end.
No, I just wanted to add, I see in the chat there are so many people sharing their stories of survivorship and wanting to come together as a community. And I think that really lies the heart of this legislation and our efforts to get this bill passed. So I just want to thank everyone for their continued partnership and enthusiasm to pass this important bill together.
Thank you all so much for joining us, for sharing your experience, you're sharing your stories, and we will be sending out a recording and the slides. I'm going to correct some typos I found before I send it out, and then you'll get more information from us about it. So thank you so much. Let us know if you have questions, and we really appreciate your support and your advocacy. Thanks, everybody.
Thank you.
Thank you.
Thanks, guys.